Hello, I'm Jeremy Fernandez. Coming up on the virus, hundreds of new cases of COVID-19 are detected, more border restrictions are imposed, and fears the outbreaks in Melbourne and southwestern Sydney are still growing. Plus, Russian hackers are accused of trying to steal research into a coronavirus vaccine. But we begin in Victoria, which has now recorded the nation's highest ever single-day increase of COVID-19. 428 people have tested positive in the space of just one day. And there is some suggestion that Victoria could be placed into level 4 restrictions. Testing is also being increased in regional Victoria, and people in those areas are being asked to wear face masks if physical distancing is impossible.
If you are out and about in regional Victoria and you don't think you can maintain that social distance, then we are requesting of you that you wear a mask. That is a small thing, but it can make a really big difference in stopping the spread of this virus and keeping those low numbers in regional Victoria very low, so that we don't have to be changing the settings and the rules for regional areas of our state.
Meanwhile, across the border in New South Wales, health authorities are also detecting new cases. Worryingly, some are what they call tertiary infections, meaning they're not directly linked to the Crossroads Hotel cluster in southwestern Sydney. Health authorities are now using genomic sequencing to work out how the virus is mutating. And to try to stop the spread of the virus, the New South Wales Premier Gladys Berejiklian has announced a return to restrictions on public gatherings, pubs, clubs, restaurants and cafes.
This is to give us every opportunity to keep New South Wales as open as possible, every opportunity for New South Wales to keep moving forward. But we say this in the context that we have to be flexible, we have to appreciate that once this disease gets into the community, it moves very, very quickly and in ways in which we can't always predict.
So in response to the outbreaks in Victoria and New South Wales, the other states and territories are raising or reintroducing border restrictions. All states and territories are stopping Victorians from visiting. Those permitted to do so must isolate for 14 days, possibly at their own expense. The situation for people from New South Wales is a little more complicated. State borders to WA, South Australia and Tasmania remain closed. Anyone who's been to one of the declared Sydney hotspots of Campbelltown and Liverpool cannot enter Queensland. No one from Greater Sydney is being allowed into the Northern Territory. People from other parts of New South Wales must complete declarations detailing whether they've been to Sydney or Victoria recently. Now, if you're from elsewhere in the country, your travel may also be blocked or curtailed if you've recently travelled through Sydney or Victoria. Is Sydney on the same path to lockdown as Melbourne? Well, it could be avoided if stricter measures are taken now. Here's our medical reporter, Sophie Scott.
The continuing spread of the virus in New South Wales is worrying experts, but some believe it could be halted with a few key measures, like ring-fencing outbreak suburbs and wearing masks.
As soon as the authorities see even a small rise in particular suburbs, they will need to ask that group to be highly compliant with wearing a mask in public, wearing a mask to work.
Luckily, there are some key differences between New South Wales and Victoria. Unlike New South Wales, Victoria had virus circulating in the community. And there were a couple of very large families exposed to the virus, meaning a lot of people were infected at once. Those differences could mean New South Wales escaped the very large outbreaks we've seen in Melbourne.
I think what the New South Wales Health Department is doing, which is basically finding as many cases as quickly as possible, really good contact tracing, isolation, quarantining, will be effective at basically controlling what at the moment is a spot fire.
Authorities will be closely monitoring how the virus spreads to see whether the measures taken in New South Wales so far are enough.
Well, despite the scale of disruption, many experts say the situation in Australia is still under control. I spoke earlier with the ABC's Dr Norman Swan and the infectious diseases specialist, Associate Professor Sanjaya Senanayake from ANU.
We're certainly seeing a bigger outbreak than I anticipated in Melbourne when we knew that when we lifted restrictions that there could be outbreaks of infections. But we're still going below testing positivity rates of 5%, which the WHO recommends for Victoria. So the number of or proportion of tests that are positive are well below 5% in Victoria. They're about 1.1%. That's still double what they were a few weeks ago, but it means that the testing is keeping on track of the cases to some extent. So we can have some confidence in that. Now that compares to, say, the US, where there are 33 states which are having over 5% positivity rates. And I think Arizona and Florida are about 20% or so. Now, having said that, we are seeing rises in cases, so I think 400 cases today. But we also know from the Wuhan experience that it did take quite a few weeks, probably a good 3 or 4 weeks after lockdown restrictions were put in place, that we started to see the outbreak come under control. So hopefully this will happen in the next week or so, but the numbers might still go up before they get better.
Dr. Swan, Dr. Sinanaika makes this good point that comparative to other countries, we're not doing too badly, but the scale of the disruption for a lot of people is massive at the moment. So how do you help people marry that up between the sort of health effects that we're seeing versus the scale of the disruption that's being imposed on us?
My impression is that most people get it. And what they get is they know how bad this could be and how quickly it can go badly. So if you get exponential growth, and that's, so you're not seeing a second wave at the moment, because you're not seeing this sort of doubling rate every 2 or 3 days, which really does, the graph just goes straight up. The graph that's going straight up at the moment is the cumulative number of cases rather than the daily. The daily rate's going up relatively slowly, but it's accumulating to quite a large number, which is why you're seeing a lot of people going to hospital. And and people understand that. People understand that you do not want to get to be like Italy or Britain or New York. And it can happen very quickly. So in New York, they waited 3 weeks. And if they hadn't waited 3 weeks, 30 or 40,000 people would not have died. The numbers are just extraordinary when you do what is primary school maths. I got criticised when I said by people saying, well, it is primary school maths. You just do the doubling, and it just gets into very large numbers very quickly. So you've got to go hard, and you've got to go early, and beg for forgiveness later. So if nothing happens, great. But something is happening in Victoria. It's significant. And they're working very hard to get it under control. I mean, it's very easy to be an armchair critic about what they're doing. It's very hard work with a very large number of outbreaks. And from what I understand, more outbreaks were announced today.
With the numbers that we're seeing right now, Dr. Sinanaika, what is it that was happening a couple of weeks ago that's caused this number of people now to be declared as infected?
So you mean in Melbourne?
In Victoria, yeah.
Okay, so why are we seeing more numbers?
Yes.
Look, I think part of it is proactive testing. When those hotspot suburbs were identified and when across the news Victorians became aware that there was a big outbreak, I think more people ended up being tested, and people who otherwise wouldn't have been tested, people with mild symptoms and asymptomatic people in those hotspot suburbs. So I think one thing about this outbreak is people are more aware that if they have any symptoms or they have any concerns, they should be getting tested. And of course, we are in the midst of an outbreak, so we are going to see more cases. So I think it is a combination of those two things. So to some extent, the fact that we are seeing more cases is a good sign that people are doing the right thing, getting tested, because as we talked about before, the only measure we really have to contain this outbreak, we don't have a great medicine the community can widely use, we don't have a vaccine, is to identify cases and their contacts and self-isolate and quarantine.
And do you have a sense then of how long it would take to flatten that curve?
Look, I would say again, going on the Wuhan experience, it might take another week or two at least.
A week or two. Norman Swan, what do you think about that?
Well, just remember this, to add to what Sanjay was saying, this is a virus that needs a cluster to trampoline out of. And home is the dangerous place. So home is where Wuhan, it was predominantly home, but homes, gymnasia, restaurants, and so on. And the confusing thing is that people have been resisting the idea that there's aerosol spread. I don't know why they've been resisting this idea. And so we're obsessed, and it's rather outdated, but it's important still for droplet spread, the 1.5 meters. So that is important for droplet spread. But it does go further than that indoors. And so the problem here is knowing where all the clusters are. So there's obviously a huge cluster in the tower block, huge cluster in the college, reasonably large clusters in the meatworks and so on, aged care homes.
Aged care homes, yeah.
You know, and this is, some of this is, so if you only think about contact being close, you miss the fact that you could be in quite a large room with somebody which has not got great ventilation for a reasonable period of time, and you'll catch the virus. Simply, if I had the virus, I'm talking like this, I'm excreting this aerosol, and you'd breathe it in. And even though I'm a safe distance away, and so these clusters can really take off. So the key thing here is they've got to find all the clusters, and they're keeping on finding new ones, and that's a bit of a worry.
Dr. Sinanaika, I want to draw your attention to a few studies that our viewers have raised with us. One of them saying there's been a study in the US this week saying a vaccine trial produced an immune response in participants. How accurate are studies such as this? I mean, if you're a layperson like me looking at these studies, how do we assess the quality of these studies and what it means more broadly?
Okay, so with either a vaccine or an infection, when you're wanting to look at an infection, natural immunity and vaccine-induced immunity, you do want to see a strong immune response. Now, if you hear that a study induced strong antibody levels, you have to think about a few things. On the one hand, it's really good, but you want to know how early and how prolonged that antibody response was. So, for example, we know from a study in King's College London, looking at people who had COVID-19, so natural infection, not vaccines, that early on, a high proportion of them had a robust antibody response, but at the 3-month mark, I think less than 20% had a robust response, which then led to the worrying conclusion that maybe people who get COVID-19 don't get much of an immune response and are susceptible to a second infection fairly soon after getting the first infection. But there are a lot of caveats around all of this. First of all, the antibody test could be done by a number of different antibody kits. And usually for a study, they use one particular antibody kit, but it is quite plausible that if they used another antibody kit, it might give a different result. Also, even if we get, say, a low antibody level, we're only testing one particular antibody. And you have to remember, when our body's immune system meets the virus, it produces antibodies to various parts of the virus. And synergistically, those other antibodies you're, you're not testing for might act with the antibody you're testing for to produce a very robust immune response. And of course, with an adaptive immune response, when we meet a virus, it's not just the antibodies, but also the T cell response that is very important in determining how we respond to a virus when we next meet it. And I think with the Oxford trial, they have recently shown that the antibody and T cell response is good, at least early on. But I don't think with the Moderna trial, they looked at the T cell response. So on the one hand, it's great that they're saying there was some antibody response, but you have to look at the whole, all of the results in more depth.
Dr. Sanjaya Sinanaika there, speaking with Norman Swan. Well, genetic sequencing is being increasingly used to identify where each person's version of the virus came from. Our national science reporter Michael Slezak explains how it works.
Scientific sleuths using genetic clues to trace the source of coronavirus outbreaks.
Well, what we're looking at is the genetic signature of the virus that's composed of its chemical building blocks, and we're trying to compare one strain against another.
Using that genetic signature, scientists can pinpoint the likely source of an outbreak and trace its spread around the world. It's already shown that hotspots in the US and Italy were sparked by different sources, both from China, and that the recent Sydney cluster was likely imported from Melbourne. For every person that gets the virus, there's a unique chain of infections back to the very first person. Each step along the way, the virus picks up new mutations. Over time, they accumulate. The virus has a unique fingerprint in every infected person, as well as the fingerprints of all the previous versions. Using that data, scientists create a genetic family tree. Looking at the unique set of mutations in one individual's virus, you can tell which branch they're on. And if you know where that branch started, you know how the virus got to that person.
They're the really key to solving the puzzle of when cases are connected. The genetics actually confirms the issue, if you like. So it's a really important component of the tracing.
And that means officials can work much more quickly at controlling the spread.
Russian spies are being accused of hacking into organisations that are developing coronavirus vaccines in Britain, America and Canada. The three nations are condemning efforts by Moscow to steal the research. Russia denies the allegations. Our Europe correspondent Samantha Hawley reports from London.
These are the propaganda images released from Moscow. In them, scientists claim to be leading the world in developing a vaccine. Now the West is calling the Kremlin out.
It's clearly wrong, contrary to international law, contrary to Russia's responsibilities as a member of the international community.
The UK, the US and Canada know their vaccine research is being hacked, and they're warning the world it's being ordered by the Kremlin.
We worked very closely with our allies to ensure that we would take measures to keep that information safe, and we continue to do so.
The three nations are pointing the finger at Russia's top spies and a group known as Cozy Bear that was also linked to email leaks during the 2016 US election.
If you want to be first to the market with your product, then one of the ways of getting there is to steal the research of somebody who else otherwise might get there ahead of you.
The nations claim hackers exploited software flaws to access vulnerable computer systems, used malware to steal files from infected machines, and tricked individuals into handing over login details, known as spear phishing attacks. No research has been compromised yet, but there's an increasing willingness to make public what intelligence agencies know.
Given that the world is trying to come together to find a vaccine, I'm afraid it's a pretty egregious behaviour, and it deserves and it should be called out.
It's not only vital vaccine work that the Kremlin is accused of meddling with. The British government says it also has evidence that Russian actors tried to influence last year's general election.
They're accused of disseminating leaked documents about a free trade agreement with America, used to the Labor opposition's advantage, but not ultimate success. Samantha Hawley, ABC News, London.
The United States has reported 77,000 new infections in one day, the highest recorded globally since the pandemic began. It's the 11th time the US has broken its own record in a month. Cases are on the rise in 41 states. In Texas, Army medical teams have been called in to ease the pressure on health facilities.
They're bringing a few physicians, they're bringing a lot of nurses, they're bringing medics, manpower, what we need to provide better service to our patients.
The country now has more than 3.5 million confirmed cases and more than 76,000 deaths. Meanwhile, Brazil has also reached a grim milestone, recording 2 million coronavirus cases. Infections there have doubled in less than a month. The country is the second worst affected nation after the United States. President Jair Bolsonaro contracted the disease last week, and he's continuing to come under heavy criticism for his management of the pandemic. On the other side of the world, India has also recorded its biggest daily surge, pushing its total number of infections there past the 1 million mark. Almost 35,000 new coronavirus cases were added today, bringing the total number of active cases to just over 342,000. There are concerns that number could rise much higher as testing in regional areas remains low. India's health system is struggling under the pressure with the pandemic. It's exposed inadequate funding and a shortage of healthcare professionals. Well, that is the very latest from the virus. There's more on our Q&A with Dr. Sanjaya Senanayake and Dr. Norman Swan. Just visit the ABC News YouTube and Facebook channels. And do keep sending us your questions to put to the experts. For now, thanks for joining us. Stay safe. Goodbye.